Question 1. The investigation demonstrates that a patient undergoing a routine eye examination exhibits a specific pattern of difficulty identifying certain red and green hues on a pseudoisochromatic plate test. The optician has confirmed the patient's inability to correctly identify several plates within the test series. Which of the following represents the most appropriate professional action for the optician in interpreting and communicating these color vision test results? Option A. Informing the patient that the test results are not clinically significant and no further action or discussion is necessary. Option B. Documenting the specific type and severity of the color vision deficiency identified, explaining the findings to the patient, and discussing potential implications for daily activities. Option C. Recording that the patient has color blindness and suggesting they may have difficulty with traffic signals. Option D. Stating that the patient has failed the color vision test and advising them to avoid careers that require accurate color discrimination. The correct answer is B. Documenting the specific type and severity of the color vision deficiency identified, explaining the findings to the patient, and discussing potential implications for daily activities. Explanation. This scenario is professionally challenging because interpreting color vision test results requires a nuanced understanding of the test's limitations and the patient's specific needs, going beyond a simple pass/fail. The optician must consider the implications of the findings for the patient's daily life and potential occupational requirements, all while adhering to professional standards and ethical obligations. Careful judgment is required to avoid misinterpretation or overstatement of the results. The correct approach involves accurately documenting the specific type and severity of color vision deficiency identified by the test, explaining these findings to the patient in clear, understandable terms, and discussing potential implications without making definitive pronouncements about their ability to perform specific tasks unless directly supported by the test results and relevant guidelines. This approach aligns with the ethical duty to provide accurate information and informed consent, as well as the professional responsibility to act in the patient's best interest. Regulatory frameworks for opticianry emphasize patient education and the accurate reporting of diagnostic findings. An incorrect approach of simply stating the patient failed the color vision test is a failure to provide adequate information and can lead to patient anxiety or misunderstanding. It neglects the professional obligation to explain the nature of the deficiency. Another incorrect approach of recommending specific occupational limitations based solely on a general color vision test result, without further assessment or knowledge of specific job requirements, is an overreach and potentially discriminatory. This violates the principle of providing evidence-based recommendations and could lead to unwarranted restrictions on the patient's opportunities. A third incorrect approach of dismissing the results as insignificant without proper explanation or consideration of the patient's concerns fails to acknowledge the potential impact of even mild deficiencies and neglects the patient's right to understand their visual status. Professionals should employ a decision-making framework that begins with a thorough understanding of the specific color vision test used and its diagnostic capabilities. This is followed by a clear and objective interpretation of the results, considering the patient's reported symptoms and lifestyle. The professional then communicates these findings empathetically and comprehensively, empowering the patient to make informed decisions. This process is guided by regulatory requirements for patient care, accurate record-keeping, and ethical practice. Question 2. During the evaluation of a patient's visual function, an optician observes that when a light is shone into the right eye, both pupils constrict equally, but when the light is shone into the left eye, the pupils constrict less briskly than when the light was in the right eye. What is the most appropriate clinical interpretation and subsequent action for the optician? Option A. Consider this a normal variation in pupillary response and proceed with dispensing eyewear without further concern. Option B. Recognize this as a relative afferent pupillary defect, RAPT, and advise the patient to consult an ophthalmologist for further investigation. Option C. Document the finding but take no further action, assuming the patient will report any symptoms if they arise. Option D. Attempt to diagnose the specific neurological condition causing the reduced pupillary response and recommend a course of treatment. Correct answer is B. Recognize this as a relative afferent pupillary defect, RAPT, and advise the patient to consult an ophthalmologist for further investigation. Explanation. This scenario is professionally challenging because the optician must accurately interpret pupillary reflexes to identify potential underlying neurological or ocular conditions that may impact vision and require referral. Misinterpreting these reflexes could lead to delayed diagnosis or inappropriate management, potentially harming the patient. The optician's role is to perform objective tests and report findings, recognizing when further medical evaluation is necessary, adhering to professional standards of care and ethical obligations to patient well-being. The correct approach involves recognizing a relative afferent pupillary defect, RAPT, and understanding its clinical significance. And RAPT indicates a difference in the direct pupillary response between the two eyes when light is shone alternately. This finding is crucial as it suggests a problem with the afferent visual pathway, which can stem from optic nerve dysfunction or severe retinal disease. The optician's responsibility, as outlined by NOCE guidelines and general opticianry practice, is to document this finding and advise the patient to seek further evaluation from an ophthalmologist or other qualified medical professional for diagnosis and management of the underlying cause. This aligns with the ethical duty to act in the patient's best interest and within the scope of practice. An incorrect approach would be to dismiss the observed pupillary asymmetry as insignificant or a normal variation without further consideration. This fails to acknowledge the potential for serious underlying pathology and violates the professional obligation to thoroughly assess visual function. Another incorrect approach would be to attempt to diagnose the specific cause of the RAPT, such as optic neuritis or glaucoma, as this falls outside the optician's scope of practice and requires medical expertise. Providing a definitive diagnosis or treatment plan for such conditions would be a regulatory and ethical breach. Finally, failing to document the finding or advise the patient to seek further medical attention would constitute negligence and a failure to uphold professional responsibilities. Professionals should approach such situations by systematically performing all required tests, meticulously documenting all findings, and critically analyzing the results in the context of potential clinical significance. When objective findings suggest a deviation from normal that could indicate a health concern, the professional decision-making process involves recognizing the limitation of their scope of practice and prioritizing patient safety by facilitating appropriate referral to a medical specialist. Question 3. The control framework reveals a patient presenting with complaints of difficulty looking down and to the left. Based on your understanding of ocular motor physiology and neuroanatomy, which of the following muscle groups and their primary cranial nerve innervation are most likely implicated in this specific movement deficit? Option A. The lateral rectus muscle and its innervation by the abducens nerve, CNVI. Option B. The superior rectus muscle and its innervation by the oculomotor nerve, CN Roman 3. Option C. The superior oblique muscle and its innervation by the trochlear nerve, CN Roman 4. Option D. The inferior oblique muscle and its innervation by the oculomotor nerve, CN Roman 3. The correct answer is B. The superior rectus muscle and its innervation by the oculomotor nerve, CN Roman 3. Explanation. This scenario is professionally challenging because it requires the optician to apply their understanding of ocular motor physiology and neuroanatomy to a patient's reported symptoms, directly impacting the accuracy of their dispensing and potential referral decisions. Misinterpreting the underlying muscle or nerve involvement could lead to incorrect lens prescriptions, frame adjustments, or a failure to recognize a potentially serious neurological issue, all of which fall under the optician's scope of practice and ethical responsibilities as defined by the National Opticianry Competency Examination, NOCE, framework. The correct approach involves accurately identifying the muscles responsible for the patient's described eye movement deficit and their corresponding cranial nerve innervation. This requires a systematic evaluation of the patient's reported symptoms in relation to the known functions of the extraocular muscles and their neural pathways. For instance, difficulty with downward and outward gaze points towards dysfunction of the inferior oblique muscle, innervated by the oculomotor nerve, CN Roman 3. The NOCE framework emphasizes the importance of understanding these fundamental principles to ensure competent patient care, including the ability to recognize when a patient's condition may require referral to a physician or other healthcare provider. This approach aligns with the NOCE mandate to assess an individual's knowledge and skills necessary for safe and effective opticianry practice. An incorrect approach would be to assume the symptom is solely related to refractive error or a simple accommodative issue without considering the underlying muscular and neural control. For example, attributing the described gaze deficit solely to the need for a stronger prescription without investigating the motor component would be a failure to adhere to the comprehensive assessment expected within the opticianry scope. This bypasses the critical step of identifying potential neurological or muscular etiologies that are outside the direct corrective capabilities of spectacle lenses alone. Another incorrect approach would be to offer a compensatory lens solution without understanding the specific muscle imbalance, potentially exacerbating the problem or masking a more significant underlying condition. Such actions would violate the ethical obligation to provide accurate and appropriate care, as implicitly tested by the NOCE, and could lead to patient harm or dissatisfaction. Professional decision-making in such situations should involve a structured process. First, carefully listen to and document the patient's reported symptoms. Second, correlate these symptoms with known ocular motor functions and their innervations. Third, consider potential causes within the optician's scope of practice, e.g., prism correction if appropriate and within scope, and crucially, identify signs or symptoms that warrant referral to a physician or other qualified healthcare professional for further diagnosis and management. This systematic evaluation ensures that patient care is both effective and ethically sound, reflecting the standards upheld by the NOCE. Question 4. Quality control measures reveal an optician incorrectly described the histological composition of the cornea, mistaking the corneal stroma for a component of the retina. This error occurred during a patient consultation regarding visual disturbances. Which of the following represents the most appropriate professional response to this quality control finding? Option A. The optician should be reprimanded for the error, and the patient should be informed of the potential for miscommunication without further action. Option B. The optician should be suspended pending a full investigation into their entire patient history for any similar anatomical misinterpretations. Option C. The optician's error is considered minor, and no further action is required as long as the patient's prescription was dispensed correctly. Option D. The optician must undergo immediate retraining on ocular histology, focusing on the distinct layers and functions of the cornea and retina, and a review of the patient's case to ensure no adverse outcomes occurred. Correct answer is D. The optician must undergo immediate retraining on ocular histology, focusing on the distinct layers and functions of the cornea and retina, and a review of the patient's case to ensure no adverse outcomes occurred. Explanation. This scenario is professionally challenging because it involves a potential discrepancy in patient care stemming from a misunderstanding of ocular anatomy, specifically the histology of the cornea and retina. The optician's responsibility extends beyond dispensing to ensuring the patient receives appropriate care and advice based on accurate anatomical knowledge. A failure to correctly identify or understand the implications of these histological features could lead to miscommunication with the patient, inappropriate lens selection, or delayed referral to a medical professional, all of which carry significant ethical and regulatory implications under the National Opticianry Competency Examination (NOCE) framework. The correct approach involves accurately identifying the histological layers of the cornea and retina and understanding their functional significance in relation to the patient's visual complaint. This requires a solid grasp of the NOCE scope of practice, which emphasizes the optician's role in understanding the optical and physiological aspects of vision. By correctly interpreting the histological findings, the optician can provide accurate information to the patient, recommend appropriate optical solutions, and, if necessary, facilitate a timely referral to an ophthalmologist or optometrist for further medical evaluation. This aligns with the ethical imperative to act in the patient's best interest and uphold professional standards of care. An incorrect approach that misidentifies the corneal stroma as part of the retina represents a fundamental failure in anatomical knowledge. This would lead to an inability to accurately assess the visual pathway and the potential causes of visual disturbances. Such a misinterpretation could result in the optician offering incorrect advice or dispensing eyewear that does not address the underlying issue, potentially exacerbating the problem or delaying necessary medical intervention. This directly violates the NOCE emphasis on accurate patient assessment and the ethical obligation to provide competent care. Another incorrect approach that fails to recognize the distinct cellular structures of the photoreceptor layer, rods and cones. In the retina, would similarly impair the optician's ability to understand the patient's visual symptoms. For instance, if a patient reports issues with low-light vision or color perception, a lack of understanding of the roles of rods and cones would prevent the optician from providing informed counseling or making appropriate recommendations. This demonstrates a deficiency in the required histological knowledge and a failure to meet the professional standard of care expected under the NOCE. Finally, an incorrect approach that confuses the Bowman's layer of the cornea with the retinal pigment epithelium demonstrates a critical lack of understanding of the layered structure and specific functions of these ocular tissues. This could lead to a misdiagnosis of the origin of visual problems and inappropriate optical interventions. The NOCE framework mandates a thorough understanding of ocular histology to ensure safe and effective optical dispensing and patient management. The professional reasoning process for similar situations should involve a systematic review of the patient's reported symptoms, a thorough understanding of relevant ocular anatomy and histology, and a clear delineation of the optician's scope of practice. When faced with uncertainty or a potential anatomical misinterpretation, the professional should prioritize patient safety by consulting reliable resources, seeking guidance from senior colleagues or supervisors, and, most importantly, erring on the side of caution by recommending a referral to a medical eye care professional. This ensures that all potential underlying medical conditions are addressed appropriately, upholding both ethical obligations and regulatory requirements. Question 5. Comparative studies suggest that individuals experiencing a noticeable decline in visual acuity and brightness perception, specifically in low-light conditions, accompanied by a visibly sluggish pupillary response when exposed to a light source, are exhibiting physiological indicators that warrant careful consideration. Given these observations, what is the most appropriate professional action for an optician to take? Option A. Recommend a comprehensive eye examination by an optometrist or ophthalmologist to investigate the underlying physiological causes of the reported symptoms and observed responses. Option B. Provide the patient with information on specialized low-light vision training exercises without referral. Option C. Attempt to adjust the patient's current eyeglass prescription to compensate for the perceived dimness and sluggish pupillary reaction. Option D. Advise the patient that reduced vision in dim light is a normal part of aging and suggest a stronger prescription for their current eyeglasses. Correct answer is A. Recommend a comprehensive eye examination by an optometrist or ophthalmologist to investigate the underlying physiological causes of the reported symptoms and observed responses. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the optician to interpret and apply knowledge of the physiology of vision, specifically phototransduction and the pupillary light reflex, in the context of patient care. The challenge lies in accurately assessing the patient's visual response and understanding the underlying physiological mechanisms to provide appropriate recommendations or identify potential issues. Misinterpreting these physiological responses could lead to incorrect dispensing decisions, inadequate patient counseling, or failure to recognize signs of underlying ocular or neurological conditions, all of which have significant implications for patient safety and the professional's liability. Correct approach analysis. The correct approach involves recognizing that the patient's description of reduced brightness perception in dim light, coupled with a sluggish pupillary response to light, strongly suggests a dysfunction in the phototransduction process, particularly involving the rod photoreceptors and a compromised pupillary light reflex. This physiological understanding directly informs the optician's next steps. The regulatory framework for the National Opticianry Competency Examination, NOCE, emphasizes the importance of a thorough understanding of visual physiology to ensure competent practice. Specifically, guidelines within the scope of opticianry practice require the identification and understanding of visual pathway functions. Therefore, recommending a comprehensive eye examination by an optometrist or ophthalmologist is the appropriate course of action. This aligns with the ethical obligation to refer patients when their condition falls outside the optician's scope of practice, or when further diagnostic evaluation is necessary. Incorrect approach is analysis. An incorrect approach would be to dismiss the patient's symptoms as normal aging, or to simply adjust the prescription without further investigation. Dismissing the symptoms ignores the physiological basis of the patient's complaint and fails to acknowledge potential underlying pathology. Adjusting the prescription without understanding the cause of the reduced brightness perception and sluggish pupil response is a direct violation of professional standards, as it does not address the root physiological issue and could mask a more serious condition. Another incorrect approach would be to provide a diagnosis or treatment plan beyond the scope of an optician's practice. Opticians are trained to dispense eyewear based on prescriptions and to understand visual optics and physiology, but not to diagnose ocular diseases or prescribe medical treatments. Attempting to do so would exceed their professional boundaries and potentially harm the patient. Professional reasoning. Professionals facing similar situations should employ a systematic decision-making process. First, actively listen to and document the patient's subjective complaints, noting specific details about the visual experience, e.g., dim light vision, brightness perception. Second, perform objective assessments within the scope of opticianry practice, such as visual acuity testing and observing pupillary responses to light. Third, integrate the subjective and objective findings with their knowledge of visual physiology, phototransduction, pupillary reflexes. Fourth, determine if the findings are within the expected range for normal visual function, or if they suggest a deviation requiring further investigation. Fifth, if a deviation is identified that falls outside the optician's scope of practice or requires diagnostic expertise, the professional obligation is to refer the patient to the appropriate healthcare provider, such as an optometrist or ophthalmologist, clearly explaining the rationale for the referral. This process ensures patient safety, adherence to professional standards, and ethical practice. Question 6. Governance review demonstrates a patient reports experiencing intermittent double vision and significant eye strain, particularly when engaged in prolonged reading tasks. The patient denies any recent changes to their prescription or any known eye diseases. The optician has performed standard visual acuity and refractive error testing, considering the patient's reported symptoms and the optician's scope of practice as defined by the National Opticianry Competency Examination, NOCE framework. What is the most appropriate next step? Option A. Conduct a comprehensive assessment of ocular motility, including saccadic and pursuit eye movements, and evaluate binocular vision function, including vergence amplitudes and phoria/tropia measurements, and refer to an optometrist or ophthalmologist if significant findings are noted. Option B. Advise the patient that their symptoms are likely due to digital eye strain from screen use and recommend over-the-counter lubricating eye drops. Option C. Adjust the patient's current spectacle prescription to a slightly higher plus power to alleviate accommodative effort during reading. Option D. Inform the patient that their symptoms are outside the scope of opticianry practice and that they should seek care from a different healthcare provider without further optician involvement. The correct answer is A. Conduct a comprehensive assessment of ocular motility, including saccadic and pursuit eye movements, and evaluate binocular vision function, including vergence amplitudes and phoria/tropia measurements, and refer to an optometrist or ophthalmologist if significant findings are noted. Explanation. This scenario is professionally challenging because it requires an optician to interpret subjective patient reports of visual discomfort and correlate them with objective findings related to ocular motility and binocular vision. The challenge lies in distinguishing between a patient's subjective experience and the underlying physiological cause, and then determining the appropriate course of action within the scope of opticianry practice as defined by the National Opticianry Competency Examination, NOCE, framework. This requires careful judgment to ensure patient safety and provide effective care without overstepping professional boundaries. The correct approach involves recognizing that the patient's reported symptoms of double vision and eye strain, particularly when reading, strongly suggest a potential issue with binocular vision or ocular muscle coordination. The optician's responsibility, as guided by NOCE principles, is to perform a thorough assessment of ocular motility and binocular vision function. This includes evaluating eye movements such as pursuits and saccades, assessing vergence abilities, and identifying any phorias or tropias. If these assessments reveal significant deviations or limitations that could be contributing to the patient's symptoms, the optician must then refer the patient to an optometrist or ophthalmologist for further diagnosis and management. This aligns with the NOCE emphasis on patient care, scope of practice, and the importance of interprofessional collaboration. When conditions fall outside the optician's direct diagnostic and treatment capabilities. An incorrect approach would be to dismiss the patient's symptoms as minor or unrelated to vision, or to attempt to prescribe corrective lenses solely based on refractive error, without investigating the reported binocular vision issues. This fails to acknowledge the patient's subjective experience and the potential for underlying ocular motility or binocular vision deficits, which are within the purview of an optician's assessment skills. Another incorrect approach would be to provide a definitive diagnosis of a specific binocular vision disorder, such as convergence insufficiency or astrabismus, and attempt to manage it with specialized lens designs without a formal diagnosis from a licensed eye care professional. This constitutes practicing beyond the scope of an optician's license and training, potentially leading to inappropriate treatment and patient harm. A third incorrect approach would be to simply adjust the patient's current prescription without a comprehensive reevaluation of their binocular vision status. While refractive error can sometimes exacerbate binocular vision problems, it does not address the root cause if the issue lies with muscle coordination or vergence. Professionals should employ a decision-making framework that prioritizes patient-reported symptoms, followed by a systematic assessment of relevant visual functions within their scope of practice. This framework involves 1. Active listening and validation of patient complaints. 2. Performing objective tests related to the reported symptoms, in this case, ocular motility and binocular vision assessments. 3. Correlating subjective complaints with objective findings. 4. Determining if the findings fall within the optician's scope of practice for management or require referral. 5. Documenting all findings and actions taken. 6. Communicating clearly with the patient about the next steps, including any necessary referrals. Question 7. Investigation of a patient's new spectacle prescription reveals a significant change in sphere power for one eye compared to their previous prescription, with no accompanying cylinder or axis change. The patient reports no specific visual complaints but seems hesitant about the magnitude of the change. What is the most appropriate course of action for the optician to ensure accurate lens dispensing? Option A. Dispense the lenses as written, assuming the practitioner made an informed decision. Option B. Contact the prescribing practitioner to confirm the prescription details and discuss the significant power change. Option C. Suggest the patient obtain a new eye examination to rule out any underlying issues. Option D. Advise the patient to return if they experience any visual discomfort after wearing the new glasses. The correct answer is B. Contact the prescribing practitioner to confirm the prescription details and discuss the significant power change. Explanation. This scenario is professionally challenging because it requires the optician to balance the patient's immediate request with the imperative to uphold professional standards and legal requirements for prescription verification. The optician must ensure the accuracy and validity of the prescription to prevent potential harm to the patient's vision and to maintain the integrity of their professional practice. The core of the challenge lies in discerning when a prescription is sufficiently questionable to warrant further investigation beyond a simple visual inspection. The correct approach involves a systematic verification process that prioritizes patient safety and regulatory compliance. This includes confirming the prescription details against the patient's previous records or, if necessary, contacting the prescribing practitioner for clarification. This methodical approach ensures that the lenses dispensed accurately reflect the prescriber's intent and are appropriate for the patient's visual needs, adhering to the principles of professional responsibility and the standards set by the National Opticianry Competency Examination (NOCE) framework, which emphasizes accurate dispensing and patient care. An incorrect approach would be to dispense lenses based solely on the written prescription without any attempt at verification, especially when there are discrepancies or ambiguities. This bypasses the essential step of ensuring prescription accuracy, potentially leading to dispensing incorrect or ineffective eyewear. Such an action would violate the ethical obligation to provide competent care and could contravene regulatory guidelines that mandate verification of prescriptions before dispensing. Another incorrect approach is to dismiss the patient's concerns about the prescription without proper investigation. While the optician is the expert in dispensing, the patient's subjective experience is a crucial data point. Ignoring these concerns without a thorough verification process could lead to patient dissatisfaction and a failure to identify a genuine issue with the prescription or its interpretation. This neglects the patient-centered aspect of opticianry. A further incorrect approach is to assume the prescription is correct simply because it is written. Prescriptions, like any document, can contain errors, be outdated, or be misinterpreted. A responsible optician must exercise professional judgment and employ verification procedures to mitigate these risks, rather than accepting the written word at face value without due diligence. The professional decision-making process for similar situations should involve a tiered approach. First, a thorough visual inspection of the prescription for obvious errors or omissions. Second, comparison with the patient's history and previous prescriptions. Third, if discrepancies or ambiguities persist, direct communication with the prescribing practitioner for clarification. And finally, if necessary, consultation with a senior optician or supervisor. This framework ensures that patient safety and regulatory compliance are paramount throughout the prescription verification process. Question 8. Benchmark analysis indicates that opticians frequently encounter situations where a patient expresses subjective discomfort or a perceived visual anomaly with a newly dispensed pair of spectacles, despite the lenses appearing to precisely match the written prescription. In such a scenario, where the optician has confirmed the measurements and the prescription parameters are accurately transcribed, what is the most appropriate and professionally responsible course of action to ensure patient care and regulatory compliance? Option A. Directly adjust the lens power or axis based on the patient's subjective feedback to improve their comfort and visual experience. Option B. Contact the prescribing eye care professional to discuss the patient's feedback and seek clarification or authorization for any necessary adjustments. Option C. Dispense the lenses as ordered, informing the patient that the prescription is accurate and any discomfort is likely due to adaptation. Option D. Recommend alternative lens designs or materials that might address the patient's perceived issues without consulting the prescriber. The correct answer is A. Directly adjust the lens power or axis based on the patient's subjective feedback to improve their comfort and visual experience. Explanation. This scenario presents a professionally challenging situation because it requires the optician to balance patient comfort and satisfaction with the absolute necessity of adhering to the prescriber's written instructions. The challenge lies in discerning when a minor adjustment might be acceptable versus when it constitutes a deviation that could compromise visual performance or patient safety and potentially violate regulatory standards. Careful judgment is required to avoid overstepping professional boundaries while still ensuring the patient receives the best possible optical correction. The correct approach involves a thorough verification of the prescription against the patient's current visual needs and the prescriber's documented order. This includes confirming all parameters, such as sphere, cylinder, axis, and prism, are accurately transcribed and understood. If a discrepancy or potential for improvement is identified that falls outside the scope of standard dispensing adjustments, the optician's ethical and regulatory obligation is to consult directly with the prescribing eye care professional. This ensures that any modification is authorized, documented, and understood by the prescriber, thereby maintaining patient safety and the integrity of the prescription. This aligns with the NOCE emphasis on accurate dispensing and professional responsibility to uphold the prescriber's intent. An incorrect approach would be to make an adjustment to the lens power based solely on the patient's subjective feedback without consulting the prescriber. This bypasses the prescriber's clinical judgment and could lead to an incorrect prescription being dispensed, potentially causing visual discomfort, eye strain, or even exacerbating existing vision problems. This action violates the principle of dispensing according to the written prescription and could be considered a breach of professional standards and regulatory guidelines that mandate adherence to prescriber orders. Another incorrect approach would be to dismiss the patient's subjective feedback entirely and proceed with dispensing the lenses exactly as ordered, even if the optician has a strong professional suspicion that the prescription might be suboptimal or contain an error. Adherence to the prescription is paramount. A complete disregard for patient feedback can lead to dissatisfaction and a failure to identify potential issues that the prescriber may wish to be aware of. This approach, while seemingly compliant, can undermine patient care and the collaborative relationship between the optician and the prescriber. A further incorrect approach would be to suggest a lens modification that is not supported by the original prescription or a subsequent authorized change from the prescriber, even if the patient expresses a preference for it. This constitutes dispensing outside the scope of the authorized prescription and could lead to legal and ethical ramifications, as well as potential harm to the patient's vision. The professional reasoning process for similar situations should involve a systematic approach. First, meticulously verify the prescription against the written order and patient measurements. Second, assess the patient's subjective feedback for any indications of potential issues or areas for clarification. Third, if any discrepancies or concerns arise that cannot be resolved through standard dispensing procedures, immediately consult with the prescribing eye care professional for clarification or authorization of any proposed changes. This ensures that all dispensing actions are compliant, ethical, and in the best interest of the patient's visual health. Question 9. The performance metrics show a patient reporting significant difficulty with depth perception and spatial judgment after receiving new eyewear, despite the dispensed lenses precisely matching the prescribed refractive correction and fitting parameters. The patient describes feeling off balance and having trouble judging distances when walking. Which of the following represents the most appropriate next step for the optician? Option A. Recommend a referral to a specialist in visual therapy or neurooptometry for a comprehensive evaluation of visual processing. Option B. Advise the patient that these symptoms are common with new prescriptions and will likely resolve with time as their brain adapts. Option C. Suggest immediate trial of alternative lens designs known to enhance spatial awareness, such as specific progressive or prism lenses. Option D. Re-verify the prescription and lens measurements multiple times to ensure absolute accuracy and rule out any dispensing error. The correct answer is A. Recommend a referral to a specialist in visual therapy or neurooptometry for a comprehensive evaluation of visual processing. Explanation. This scenario is professionally challenging because it requires the optician to interpret subjective patient feedback in the context of objective visual processing capabilities, while adhering to the ethical and regulatory standards of the National Opticianry Competency Examination. NOCE. The optician must move beyond simply dispensing based on a prescription and consider how the patient's brain is actually interpreting the visual information. This involves understanding that visual processing is a complex neurological function, not solely dependent on refractive correction. Careful judgment is required to differentiate between a potential dispensing error, a need for further visual therapy referral, or a patient's subjective adaptation to new visual input. The correct approach involves recognizing that the patient's reported difficulties with depth perception and spatial awareness, despite a seemingly accurate prescription, point towards potential issues in visual processing. This approach prioritizes patient well-being and optimal visual function by recommending a referral to a specialist in visual therapy or neurooptometry. This aligns with the NOCE emphasis on comprehensive patient care and the ethical obligation to refer when a condition falls outside the scope of opticianry practice. Such a referral ensures the patient receives specialized assessment and intervention for visual processing deficits, which are beyond the typical scope of an optician's direct treatment. An incorrect approach that focuses solely on rechecking the prescription and lens measurements fails to address the underlying issue of visual processing. While ensuring dispensing accuracy is crucial, it does not account for the patient's reported subjective experiences related to how their brain is interpreting visual information. This approach risks overlooking a treatable visual processing disorder, potentially leading to continued patient dissatisfaction and suboptimal visual outcomes. Another incorrect approach, which involves simply advising the patient to get used to it or that their brain will adapt, dismisses the patient's concerns and the potential for underlying visual processing deficits. This is ethically problematic as it fails to provide appropriate care and support. It also fails to acknowledge the established understanding of visual processing as a trainable and sometimes impaired neurological function. A further incorrect approach, such as immediately suggesting a change in lens design without further investigation into the visual processing aspect, is premature and potentially unnecessary. While lens design can influence visual perception, it is not the primary solution for diagnosed or suspected visual processing disorders. This approach bypasses the critical step of identifying the root cause of the patient's difficulties. The professional decision-making process for similar situations should involve a systematic evaluation. First, confirm the accuracy of the dispensed eyewear against the prescription. Second, actively listen to and document the patient's subjective complaints, paying close attention to descriptions that suggest difficulties beyond simple refractive error, e.g., depth perception, spatial judgment, visual motor coordination. Third, Consider the patient's reported symptoms in the context of known visual processing functions. Fourth, if symptoms suggest a visual processing deficit, determine if the scope of opticianry practice allows for direct intervention or if referral to a specialist is the most appropriate and ethical course of action, aligning with NOCE guidelines for patient care and professional boundaries. Question 10. The review process indicates a patient presence with a chief complaint of difficulty tracking lines of text while reading, reporting that the words sometimes appear to swim or blur. The patient also mentions experiencing occasional double vision, particularly when tired after a long day. Based on the NOCE emphasis on understanding visual function, which of the following best describes the likely underlying optician-relevant issue and the appropriate initial consideration? Option A. The patient's symptoms are likely due to a need for a stronger spherical prescription, and the optician should proceed with a standard refraction. Option B. The patient's symptoms suggest a need for prism correction, and the optician should directly prescribe prism based on the reported double vision. Option C. The patient's symptoms indicate a potential neurological issue, and the optician should immediately refer the patient to a neurologist. Option D. The patient's symptoms are highly suggestive of a deficit in smooth pursuit eye movements or convergence insufficiency, which an optician should consider when evaluating lens options or recommending further assessment. The correct answer is D. The patient's symptoms are highly suggestive of a deficit in smooth pursuit eye movements or convergence insufficiency, which an optician should consider when evaluating lens options or recommending further assessment. Explanation. This scenario is professionally challenging because it requires the optician to accurately identify and interpret subtle visual system dysfunctions that could impact a patient's daily activities and safety. The optician must go beyond simply dispensing eyewear and demonstrate a deeper understanding of ocular motility and its functional implications, aligning with the NOCE emphasis on comprehensive patient care and the application of opticianry principles. The correct approach involves recognizing that the patient's description of difficulty tracking text during reading, coupled with occasional double vision when fatigued, strongly suggests a deficit in smooth pursuit eye movement or convergence insufficiency. Smooth pursuit is crucial for maintaining fixation on a moving object, such as text on a page, allowing for continuous visual input. Convergence is essential for directing both eyes inward to focus on near objects, and its insufficiency can lead to diplopia and asthenopia. An optician's responsibility, within the scope of practice tested by the NOCE, includes identifying potential underlying visual inefficiencies that may require further evaluation or specific lens designs to mitigate. An incorrect approach would be to dismiss the patient's symptoms as simply a need for a stronger prescription without further investigation. This fails to acknowledge the functional nature of the reported issues and ignores the possibility of a binocular vision anomaly. Ethically and professionally, this approach neglects the optician's duty to provide thorough care and to identify potential problems that could affect the patient's visual well-being and performance. Another incorrect approach would be to immediately recommend prism correction without a comprehensive assessment of the specific eye movement disorder. While prism may be a solution, its prescription requires careful diagnosis of the underlying cause and magnitude of the deviation. Prescribing prism without proper evaluation is premature and could lead to inappropriate correction, potentially exacerbating the problem or causing new visual discomfort. This deviates from the principle of evidence-based practice and patient-centered care. A third incorrect approach would be to suggest the patient see a physician for a neurological workup solely based on these symptoms. While neurological conditions can affect eye movements, the described symptoms are also highly indicative of common binocular vision dysfunctions that fall within the optician's purview to identify and potentially address through optical means or referral for vision therapy. Over-referral without initial opticianry assessment is inefficient and may not be the most direct path to resolving the patient's visual complaint. The professional decision-making process for similar situations should involve a systematic approach. Actively listen to and validate patient complaints. Consider the functional implications of reported symptoms. Correlate symptoms with known types of eye movements and their functions. Assess for common binocular vision anomalies within the scope of opticianry, and determine the most appropriate next step, which may include prescription adjustment, specific lens recommendations, or referral for further evaluation by an optometrist or ophthalmologist. Question 11. The efficiency study reveals that a new optician is consistently taking longer to measure pupillary distance, PD, than their colleagues, leading to concerns about workflow. The new optician explains they are using a specialized measuring device that requires careful alignment and double-checking against the patient's corneal reflection, even when the patient is wearing their habitual prescription. This method, while slower, has resulted in 0 remakes due to PD errors in their dispensed eyewear. Which of the following approaches best reflects the professional and regulatory expectations for accurate PD measurement in the context of the National Opticianry Competency Examination, NOCE? Option A. Implementing a standardized, rapid visual estimation technique for PD measurement, as demonstrated by the more experienced opticians, to improve overall workflow efficiency. Option B. Utilizing a standard ruler-based PD measurement technique, but skipping the final verification step to save time, assuming the initial measurement is sufficiently close. Option C. Relying on the patient's self-reported PD measurement, as they are often aware of their own visual needs and can provide a quick estimate. Option D. Adopting the new optician's meticulous method of PD measurement, prioritizing accuracy and patient outcomes over speed, and seeking opportunities for further training to optimize efficiency without compromising precision. Correct answer is D. Adopting the new optician's meticulous method of PD measurement, prioritizing accuracy and patient outcomes over speed, and seeking opportunities for further training to optimize efficiency without compromising precision. Explanation. The efficiency study reveals a common challenge in opticianry, ensuring consistent and accurate pupillary distance, PD measurements across different practitioners. This scenario is professionally challenging because an inaccurate PD can lead to significant visual discomfort, eye strain, and even induced prism, directly impacting patient vision and satisfaction. The NOCE emphasizes the importance of precise measurements as a foundational skill for dispensing eyewear. Regulatory frameworks, such as those governing the practice of opticianry, mandate that practitioners adhere to established standards of care to ensure patient safety and the efficacy of prescribed optical devices. Ethical considerations also dictate that practitioners act in the best interest of the patient, which includes providing accurate and reliable measurements. The correct approach involves utilizing a standardized, validated method for PD measurement, such as using a pupillometer or a well-calibrated ruler with a mirror, and confirming the measurement with the patient or by remeasuring. This approach aligns with the NOCE focus on competency in fundamental opticianry skills and adheres to the implicit regulatory requirement for accuracy and precision in dispensing. It ensures that the optical center of the lens is correctly aligned with the patient's visual axis, a critical factor for clear and comfortable vision. An incorrect approach that relies solely on a quick visual estimation without a measuring instrument fails to meet the required standard of care. This is a direct violation of the principle of accuracy mandated by opticianry regulations and the NOCE competency standards. Another incorrect approach, such as accepting a PD measurement provided by the patient without verification, introduces a significant risk of error. While patient input is valuable, the optician remains responsible for the accuracy of the dispensed prescription, and relying solely on a patient's self-reported measurement bypasses the professional's duty to ensure precision. A third incorrect approach, which involves using a measurement taken under suboptimal lighting conditions or with the patient in an uncorrected state, e.g., without their habitual prescription if available, can also lead to inaccuracies. The NOCE expects practitioners to control variables that affect measurement accuracy, and lighting and refractive state are key factors. Professional decision-making in such situations requires a commitment to established protocols, a thorough understanding of the impact of measurement accuracy on visual outcomes, and a patient-centered approach that prioritizes the delivery of a correctly dispensed product. When faced with potential inconsistencies or challenges in measurement, a professional should default to validated measurement techniques and seek confirmation rather than relying on approximations or unverified information. Question 12. Assessment of a patient's visual needs and lifestyle, followed by a detailed explanation of the optical properties, impact resistance, weight, and UV protection of glass, plastic, and polycarbonate lenses, leading to a collaborative selection of the most appropriate material, best exemplifies which aspect of opticianry practice. Option A. Patient-centered lens material selection. Option B. Cost-driven lens material recommendation. Option C. Optician's personal material preference. Option D. Material durability prioritization over optical clarity. The correct answer is A. Patient-centered lens material selection. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the optician to balance patient needs and preferences with the inherent properties and limitations of different lens materials. The optician must possess a thorough understanding of glass, plastic, and polycarbonate lenses, not just their basic characteristics, but also their suitability for specific patient lifestyles, prescriptions, and safety considerations. Failure to accurately assess and communicate these factors can lead to patient dissatisfaction, compromised vision, or even safety risks, all of which fall under the optician's professional responsibility. Correct approach analysis. The correct approach involves a comprehensive discussion with the patient about their lifestyle, visual demands, and prescription. This includes explaining the advantages and disadvantages of each lens material, glass, plastic, polycarbonate, in relation to their specific needs. For instance, polycarbonate is often recommended for safety eyewear due to its impact resistance, while high-index plastics might be preferred for strong prescriptions to reduce lens thickness and weight. Glass, while offering superior optical clarity and scratch resistance in some cases, is heavier and more prone to shattering, making it less suitable for certain activities or prescriptions. The optician must guide the patient towards a material that optimizes their vision, comfort, and safety, adhering to professional standards of care and patient education. This aligns with the NOCE emphasis on competent patient care and informed decision-making. Incorrect approach is analysis. Recommending a lens material solely based on cost without considering the patient's visual needs or lifestyle is an ethical and professional failure. This prioritizes commercial interests over patient well-being and can lead to suboptimal vision or safety. Suggesting a lens material without discussing its impact resistance or suitability for the patient's activities, especially if the prescription warrants consideration of safety, is a dereliction of duty. The optician has a responsibility to inform patients about potential risks and benefits associated with different materials. Choosing a lens material based on personal preference rather than objective assessment of the patient's prescription and lifestyle disregards the core principle of patient-centered care. This can result in a lens that is aesthetically unappealing, uncomfortable, or functionally inadequate for the patient. Professional reasoning. Professionals should approach lens material selection by first conducting a thorough patient assessment. This includes understanding their prescription, visual demands, e.g., computer use, outdoor activities, sports, lifestyle, and any specific concerns they may have. Following this assessment, the optician should educate the patient on the properties of available lens materials, glass, plastic, and polycarbonate, detailing their respective advantages and disadvantages concerning optical clarity, weight, impact resistance, UV protection, and cost. The decision should be a collaborative one, with the optician providing expert guidance to help the patient make an informed choice that best meets their individual needs and ensures optimal visual performance and safety. Question 13. Upon reviewing a patient's subjective report of a persistent, dark, curtain-like shadow obscuring the lower half of their vision in one eye, and subsequent visual field testing revealing a dense, inferior altitudinal defect, what is the most appropriate course of action for the optician? Option A. Attempt to explain to the patient that this is indicative of a specific type of stroke affecting the optic nerve. Option B. Advise the patient to seek immediate care from a neurologist without first consulting an ophthalmologist. Option C. Document the findings, explain the visual field defect, and refer the patient to an ophthalmologist for further evaluation and diagnosis of the underlying cause. Option D. Reassure the patient that this is likely a benign visual anomaly and monitor it at future appointments. The correct answer is C. Document the findings, explain the visual field defect, and refer the patient to an ophthalmologist for further evaluation and diagnosis of the underlying cause. Explanation. This scenario presents a professional challenge because the optician is faced with interpreting complex patient-reported symptoms that suggest a significant neurological issue. The optician's role is to accurately assess visual function and identify potential abnormalities, but not to diagnose neurological conditions. Misinterpreting or overstepping the scope of practice can lead to delayed or incorrect medical referrals, potentially harming the patient. Careful judgment, is required to balance thorough visual assessment with appropriate referral pathways. The correct approach involves recognizing the potential neurological implications of the described visual field defect and initiating the appropriate referral process. This aligns with the ethical and regulatory responsibilities of an optician to ensure patient safety and well-being. Specifically, the National Opticianry Competency Examination (NOCE) framework emphasizes the importance of identifying visual anomalies that may require further medical investigation. By documenting the patient's subjective complaints and objective findings, and then referring to a qualified medical professional, such as an ophthalmologist or neurologist, for definitive diagnosis and management, the optician acts within their scope of practice and upholds their duty of care. This ensures the patient receives the necessary specialized medical attention for their suspected neurological condition. An incorrect approach would be to attempt to diagnose the specific neurological cause of the visual field defect. This oversteps the optician's scope of practice, as diagnosis of neurological conditions falls under the purview of physicians. Such an attempt could lead to misdiagnosis, inappropriate patient reassurance or alarm, and a delay in seeking proper medical evaluation, all of which are ethically and regulatorily unacceptable. Another incorrect approach would be to dismiss the patient's symptoms as minor or unrelated to a serious condition without proper investigation and referral. This failure to recognize the potential severity of the reported visual field defect and its neurological correlates would be a breach of the optician's duty to thoroughly assess visual function and advocate for the patient's health. It neglects the responsibility to identify potential red flags that warrant further medical attention. A further incorrect approach would be to provide the patient with information or advice that suggests a specific neurological diagnosis or treatment plan. This is outside the optician's professional expertise and could lead to patient confusion, anxiety, or reliance on unqualified advice, thereby compromising patient care and potentially violating professional standards. The professional reasoning process in such a situation should involve a systematic approach. First, thoroughly assess the patient's visual field using appropriate instrumentation and techniques. Second, carefully document all subjective complaints and objective findings. Third, recognize symptoms or patterns that suggest a potential underlying neurological cause, even if the specific cause cannot be determined. Fourth, consult with a supervisor or senior colleague if unsure about the interpretation or appropriate next steps. Fifth, initiate a timely and appropriate referral to a qualified medical professional, clearly communicating the observed visual findings and the patient's reported symptoms. This structured approach ensures that patient care is prioritized, professional boundaries are respected, and regulatory requirements are met. Question 14. Risk assessment procedures indicate that a patient presents with a pair of existing spectacles and reports that their vision has changed. The optician needs to determine the current optical parameters of these spectacles to compare with the new prescription. Which of the following approaches best reflects the required professional standard for this assessment? Option A. Rely on the prescription label that may be attached to the spectacle case, assuming it accurately reflects the current lenses. Option B. Ask the patient to describe how well they see with their current glasses and proceed based on their subjective feedback. Option C. Visually estimate the lens power and curvature of the existing lenses based on their appearance. Option D. Use a lensometer to precisely measure the sphere, cylinder, axis, and prism of the existing lenses and record these findings. Correct answer is D. Use a lensometer to precisely measure the sphere, cylinder, axis, and prism of the existing lenses and record these findings. Explanation. This scenario is professionally challenging because it requires the optician to accurately assess and document existing lens parameters to ensure proper dispensing and patient safety, adhering to established professional standards. The core of the challenge lies in the precise measurement of lens power, prism, and optical center, which directly impacts visual acuity and comfort. Misinterpretation or inaccurate measurement can lead to dispensing errors, patient dissatisfaction, and potential harm. The correct approach involves meticulously using a lensometer to measure the sphere, cylinder, axis, and prism of the existing spectacle lenses. This process must be performed with careful attention to detail, ensuring the lensometer is properly calibrated and the measurements are recorded accurately. This aligns with the National Opticianry Competency Examination (NOCE) standards, which emphasize the optician's responsibility to verify existing prescriptions and dispensed eyewear. Accurate measurement is fundamental to ensuring the dispensed eyewear meets the patient's needs as prescribed, and that any existing issues are correctly identified and addressed. This directly supports the ethical obligation to provide competent and safe vision care. An incorrect approach of simply estimating the lens power based on visual inspection is professionally unacceptable. This method lacks the precision required for opticianry and bypasses the fundamental requirement of objective measurement. It fails to meet the NOCE expectation of using appropriate instrumentation for accurate assessment, potentially leading to dispensing eyewear that does not match the patient's prescription or the intended visual correction. Another incorrect approach of relying solely on the patient's subjective report of their current vision without objective measurement is also professionally unsound. While patient feedback is important, it cannot replace the need for precise, objective measurement of the existing lenses. This approach neglects the optician's duty to verify the physical characteristics of the eyewear, which is a critical step in the dispensing process and a core competency assessed by the NOCE. Failing to document the measurements taken with the lensometer is another professionally deficient approach. Accurate and thorough documentation is a cornerstone of professional practice, providing a record of the dispensed eyewear and the measurements taken. This omission hinders accountability, makes it difficult to troubleshoot future issues, and does not meet the expected standards of record-keeping for patient care as implied by NOCE competencies. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the core task, accurately assess existing lens parameters. 2. Determine the appropriate tools and techniques, utilize a calibrated lensometer for precise measurement. 3. Execute the task with meticulous attention to detail, perform measurements carefully and record them accurately. 4. Verify the results, double-check measurements if necessary. 5. Document all findings, maintain clear and comprehensive records. 6. Consider patient feedback in conjunction with objective data. Question 15. Performance analysis shows that a patient who works extensively on a computer and frequently drives at night is experiencing visual fatigue and glare. They have expressed a preference for a lens that looks good and is lightweight. Which approach best addresses this patient's needs and adheres to professional opticianry standards? Option A. Recommending the lightest available lens material and a fashionable frame, assuming this will address the patient's visual fatigue and glare concerns. Option B. Discussing the benefits of specific lens materials like high-index plastics for weight reduction and advanced anti-reflective coating designed to reduce glare and digital eye strain, while also explaining how specific lens designs can optimize vision for near and distance tasks. Option C. Suggesting a standard single vision lens with a basic scratch-resistant coating, as this is a cost-effective option that meets the basic refractive correction. Option D. Focusing solely on the patient's preference for a lightweight lens and recommending the thinnest lens material available without further discussion of coatings or designs. The correct answer is B. Discussing the benefits of specific lens materials like high-index plastics for weight reduction and advanced anti-reflective coatings designed to reduce glare and digital eye strain, while also explaining how specific lens designs can optimize vision for near and distance tasks. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the optician to balance patient preference and perceived benefit with the objective performance characteristics of lens materials and designs, all within the scope of their professional responsibility and regulatory guidelines. The patient's subjective experience, while important, must be grounded in the optical principles and material science that underpin lens performance. Misinterpreting or overemphasizing subjective feedback without considering objective factors can lead to suboptimal dispensing and potential patient dissatisfaction, or even harm if the chosen lens is not appropriate for their visual needs or lifestyle. Correct approach analysis. The correct approach involves a thorough understanding of the patient's visual needs, lifestyle, and prescription, combined with a detailed explanation of how different lens materials, e.g. polycarbonate, Trivex, high-index plastics, glass, designs, e.g. single-vision, bifocal, progressive, aspheric, and coatings, e.g. anti-reflective, scratch-resistant, UV protection, photochromic, address those needs. The optician must then guide the patient toward a lens solution that objectively offers the best visual acuity, comfort, and durability, explaining the rationale behind the recommendation based on the properties of the chosen lens. This aligns with the NOCE emphasis on dispensing lenses that are appropriate for the patient's refractive error and intended use, ensuring patient safety and visual well-being. The regulatory framework for opticians mandates competence in lens selection and dispensing, requiring professionals to apply their knowledge of optical principles and materials to meet patient needs effectively and ethically. Incorrect approach is analysis, recommending a lens solely based on the patient's stated preference for a specific brand or appearance, without a thorough assessment of their visual needs and the objective performance of that lens, is an ethical failure. This approach prioritizes marketing or aesthetics over functional optics and patient well-being, potentially leading to a lens that does not adequately correct their vision or is not durable enough for their lifestyle, suggesting a lens material or design that is significantly more complex or expensive than necessary for the patient's prescription and visual demands, without clear justification of its benefits, constitutes a failure to act in the patient's best interest. This could be seen as upselling without providing commensurate value and may violate ethical principles of honest and transparent practice. Dismissing the patient's concerns about lens performance or comfort without investigating the underlying cause and offering appropriate solutions demonstrates a lack of professional diligence. This approach fails to address potential issues with the current lens or dispensing, potentially leaving the patient with unresolved visual problems. Professional reasoning. Professionals should adopt a patient-centered approach that integrates objective optical knowledge with subjective patient feedback. This involves active listening to understand the patient's concerns and lifestyle, followed by an evidence-based recommendation of lens options. The decision-making process should involve 1. Comprehensive patient assessment, prescription, visual demands, lifestyle, ocular health. 2. Education of the patient on relevant lens technologies and their benefits/limitations. 3. Collaborative decision-making, guiding the patient towards the most appropriate and beneficial lens solution. 4. Verification of lens performance post-dispensing. This systematic approach ensures that dispensing decisions are grounded in both patient needs and professional expertise, adhering to regulatory and ethical standards. Question 16. Implementation of a comprehensive assessment for a patient reporting intermittent double vision and eye strain during prolonged reading, considering potential binocular vision anomalies. Option A. Immediately prescribe a stronger reading edition without performing any specific binocular vision testing. Option B. Perform a thorough evaluation of fusional vergence ranges, accommodative facility, and fixation disparity. And if findings suggest a binocular vision disorder, refer the patient to an optometrist for further diagnosis and management. Option C. Recommend over-the-counter eye drops for dry eye, assuming the symptoms are solely due to ocular surface discomfort. Option D. Advise the patient that these symptoms are common with extended near work and suggest they simply take more frequent breaks. Correct answer is B. Perform a thorough evaluation of fusional vergence ranges, accommodative facility, and fixation disparity, and if findings suggest a binocular vision disorder, refer the patient to an optometrist for further diagnosis and management. Explanation. This scenario presents a professional challenge because an optician must interpret subjective patient reports of visual discomfort and correlate them with objective findings, ensuring the patient receives appropriate care without overstepping the scope of practice. The optician's role is to identify potential binocular vision issues that may require further evaluation by an optometrist or ophthalmologist. Careful judgment is required to differentiate between common refractive errors and underlying binocular vision anomalies that can significantly impact visual comfort and performance. The correct approach involves a systematic assessment of the patient's reported symptoms, considering potential binocular vision disorders such as convergence insufficiency, divergence excess, or phorias. This includes performing appropriate tests to evaluate fusional vergence ranges, accommodative facility, and fixation disparity. Based on these findings, the optician can then recommend further diagnostic testing or referral to an eye care professional if a binocular vision disorder is suspected. This aligns with the ethical responsibility to provide competent care and to refer when necessary, as guided by professional standards and the scope of practice for opticians, which emphasizes the importance of recognizing and managing conditions that fall within their expertise while respecting the boundaries of other healthcare professions. An incorrect approach would be to dismiss the patient's symptoms as minor or solely attributable to refractive error without further investigation. This fails to acknowledge the potential impact of binocular vision disorders on visual comfort and performance, potentially leading to delayed diagnosis and treatment. Another incorrect approach would be to attempt to diagnose and manage a complex binocular vision disorder without the necessary specialized training or diagnostic tools, or to provide prescriptive lenses or vision therapy without a proper referral and diagnosis from an optometrist or ophthalmologist. This constitutes practicing beyond the scope of opticianry and could result in inappropriate treatment and harm to the patient. Professionals should approach such situations by actively listening to patient complaints, performing a thorough and relevant series of tests within their scope of practice, and critically analyzing the results in conjunction with the patient's reported symptoms. If findings suggest a binocular vision disorder, the professional decision-making process should involve clear documentation, communication with the patient about potential issues, and a timely referral to the appropriate eye care professional for definitive diagnosis and management. Question 17. Which approach would be most effective for an optician to explain the interconnected functions of the cornea, sclera, iris, ciliary body, lens, retina, choroid, and optic nerve to a patient seeking to understand how their vision works? Option A. A simplified overview that groups the iris and ciliary body together as structures controlling light entry and focus. Option B. A comparative analysis highlighting the unique role and contribution of each structure to the overall visual process. Option C. An in-depth discussion of the biochemical processes occurring within the photoreceptor cells of the retina. Option D. A detailed explanation of the refractive power of the lens and its primary role in focusing light. The correct answer is B. A comparative analysis highlighting the unique role and contribution of each structure to the overall visual process. Explanation. This scenario is professionally challenging because it requires an optician to accurately identify and explain the function of specific ocular structures to a patient who may have limited medical knowledge. The challenge lies in translating complex anatomical and physiological information into understandable terms while maintaining professional accuracy and adhering to the scope of practice defined by the National Opticianry Competency Examination (NOCE) regulatory framework. Misinformation or overstepping professional boundaries could lead to patient confusion, anxiety, or inappropriate self-treatment. A comparative analysis of ocular anatomy, focusing on the distinct roles of the cornea, sclera, iris, ciliary body, lens, retina, choroid, and optic nerve, is the correct approach. This method allows for a structured and accurate explanation of how each part contributes to vision. The NOCE framework emphasizes the importance of providing clear, accurate, and relevant information to patients within the scope of opticianry. By comparing and contrasting the functions of these structures, the optician can build a comprehensive understanding for the patient, highlighting how damage or dysfunction in one area can impact overall visual acuity and perception. This aligns with the ethical obligation to educate patients and facilitate informed decision-making regarding their eye care. An approach that focuses solely on the refractive properties of the lens, without acknowledging the contributions of other structures, would be an incorrect and incomplete explanation. This fails to meet the NOCE standard for comprehensive patient education regarding ocular anatomy. Similarly, an approach that delves into the detailed cellular mechanisms of photoreception in the retina, while scientifically accurate, would likely exceed the scope of what is necessary or understandable for a typical patient, potentially leading to confusion rather than clarity. This over-technical explanation deviates from the NOCE emphasis on practical, patient-centered communication. An approach that conflates the functions of the iris and the ciliary body, for instance, by suggesting they both solely control light intensity, will be factually incorrect and demonstrate a lack of understanding of their distinct roles in pupillary constriction and accommodation, respectively. This directly violates the NOCE requirement for accurate anatomical and functional descriptions. The professional decision-making process for similar situations involves first assessing the patient's level of understanding and their specific questions. Then, the optician should access their knowledge base regarding ocular anatomy and physiology, ensuring it is aligned with the NOCE curriculum. The information should be presented in a clear, concise, and comparative manner, using analogies if helpful, but always maintaining scientific accuracy. The optician must remain within their scope of practice, avoiding diagnosis or treatment recommendations, and instead focus on explaining the structures and their functions as they relate to the patient's visual experience or the optical correction being provided. Question 18. The analysis reveals that a patient presents with a prescription indicating a need for correction of both spherical error and astigmatism. Considering the primary refractive surfaces of the eye, which of the following best describes the optician's responsibility in ensuring appropriate lens selection for this patient? Option A. The optician should defer all decisions regarding the interplay of corneal and lenticular refractive properties to the prescribing eye care professional, limiting their role to simply dispensing the prescribed lenses without further consideration. Option B. The optician should primarily focus on correcting the spherical component of the prescription, as this represents the most significant refractive error, and assume the astigmatic correction will be adequately addressed by standard lens designs. Option C. The optician must ensure the selected lens effectively compensates for the total refractive power required, acknowledging that both the cornea and the crystalline lens contribute significantly to the eye's overall refractive state, and that astigmatism often has a significant corneal component. Option D. The optician should prioritize lens materials that offer the highest refractive index, as this will inherently compensate for any refractive anomalies related to the cornea and lens, regardless of the specific prescription details. The correct answer is C. The optician must ensure the selected lens effectively compensates for the total refractive power required, acknowledging that both the cornea and the crystalline lens contribute significantly to the eye's overall refractive state, and that astigmatism often has a significant corneal component. Explanation. The analysis reveals a scenario where an optician must interpret and apply knowledge of the refractive properties of the cornea and lens to a patient's visual needs, within the specific regulatory framework of the National Opticianry Competency Examination, NOCE. This is professionally challenging because it requires not only a theoretical understanding of optics, but also the ability to translate that understanding into practical patient care, ensuring compliance with standards of practice that prioritize patient safety and visual well-being. Misinterpreting these properties can lead to inappropriate lens selection, resulting in suboptimal vision correction, patient dissatisfaction, and potential harm. The correct approach involves accurately assessing how the cornea and lens contribute to the overall refractive power of the eye, and how variations in these structures, such as astigmatism or changes in lens power due to accommodation or presbyopia, affect visual acuity. This understanding is crucial for selecting the appropriate ophthalmic lenses that compensate for these refractive errors. The NOCE framework emphasizes the optician's role in dispensing eyewear that meets the prescribed refractive correction, ensuring the patient achieves clear and comfortable vision. This aligns with the ethical obligation to provide competent and safe patient care, as implicitly required by the standards tested in the NOCE. An incorrect approach would be to overlook or misinterpret the specific contributions of the cornea and lens to the patient's refractive error. For instance, focusing solely on the lens correction without considering the corneal component of astigmatism would lead to an incomplete or inaccurate prescription fulfillment. This failure to consider the integrated refractive system of the eye violates the implicit standard of care expected of a competent optician, which necessitates a comprehensive understanding of ocular optics for effective dispensing. Another incorrect approach would be to assume that a standard lens design will suffice without considering how the patient's individual corneal and lenticular properties might necessitate specialized lens designs or adjustments, potentially leading to visual discomfort or reduced acuity. This demonstrates a lack of due diligence in applying optical principles to individual patient needs, which is contrary to the professional standards promoted by the NOCE. Professionals should approach such situations by first recalling the fundamental principles of ocular optics, specifically the refractive power contributions of the cornea and crystalline lens. They should then consider how these contributions interact to create the overall refractive state of the eye. When presented with a patient's prescription, the optician must evaluate whether the prescribed correction adequately addresses the refractive errors stemming from both corneal and lenticular factors. This involves understanding common refractive anomalies like myopia, hyperopia, astigmatism, both corneal and lenticular, and presbyopia, and how different lens types and materials can effectively compensate for them. The decision-making process should prioritize patient comfort, visual acuity, and adherence to the prescriber's intent, all within the scope of practice defined by the NOCE. Question 19. Process analysis reveals that a patient presents with difficulty abducting their eye, which cranial nerve is primarily responsible for the action of abduction and which extraocular muscle facilitates this movement? Option A. Cranial nerve VI abducens, innervating the lateral rectus muscle. Option B. Cranial nerve Roman 4 trochlear, innervating the superior oblique muscle. Option C. Cranial nerve V trigeminal, innervating the medial rectus muscle. Option D. Cranial nerve Roman 3 oculomotor, innervating the superior rectus muscle. Correct answer is A. Cranial nerve VI abducens, innervating the lateral rectus muscle. Explanation: this scenario is professionally challenging because an optician must accurately identify the muscles responsible for specific eye movements and their corresponding cranial nerve innervation to effectively assess and address patient vision issues. Misidentification can lead to incorrect lens prescription, improper prism application, or failure to recognize underlying neurological conditions that affect ocular motility. The NOCE emphasizes this knowledge to ensure patient safety and the provision of competent optical care. The correct approach involves precisely recalling and applying knowledge of the extraocular muscles and their innervation. This understanding is fundamental to opticianry practice, as it directly informs how visual discrepancies related to eye alignment and movement are interpreted and managed. Regulatory frameworks for opticianry, such as those implicitly tested by the NOCE, mandate a thorough understanding of ocular anatomy and physiology, including neuromuscular control of the eyes, to ensure practitioners can perform their duties competently and safely. An incorrect approach that misattributes the innervation of a muscle responsible for a primary gaze direction, such as abduction, would be professionally unacceptable. This failure demonstrates a lack of foundational knowledge, potentially leading to misdiagnosis or inappropriate treatment recommendations. For instance, confusing the abducens nerve VI with the oculomotor nerve Roman 3 when discussing lateral eye movement would result in an incorrect assessment of the cause of diplopia or strabismus. Similarly, incorrectly identifying the trochlear nerve, Roman 4, as innervating the superior rectus muscle instead of the superior oblique muscle would lead to a flawed understanding of vertical and torsional eye movements. Incorrectly associating the trigeminal nerve V with eye muscle movement, rather than its role in facial sensation and mastication, represents a fundamental misunderstanding of cranial nerve functions relevant to opticianry. Professionals should approach such questions by systematically reviewing their knowledge of the 6 extraocular muscles: superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique, and their respective cranial nerve innervations: oculomotor nerve Roman 3, trochlear nerve Roman 4, abducens nerve VI. When presented with a specific eye movement, the professional should mentally trace the muscle responsible and its nerve supply. This systematic recall and application of anatomical and physiological knowledge, grounded in the principles tested by the NOCE, ensures accurate patient care. Question 20. The audit findings indicate a potential misinterpretation of the histological characteristics of a patient's corneal stroma as documented in their recent examination report. As an optician, you have reviewed the report and the associated histological images, and you believe the documented interpretation does not accurately reflect the typical cellular structure and arrangement you would expect based on your understanding of corneal histology. This discrepancy could impact the recommended lens prescription or management plan for the patient. What is the most appropriate course of action? Option A. Contact the external regulatory board directly to report the suspected misinterpretation of histological data without consulting internal colleagues or supervisors. Option B. Independently reinterpret the histological images and unilaterally adjust the patient's management plan based on your revised understanding, without further consultation. Option C. Consult with a senior optician or optometrist within the practice to review the audit findings and histological documentation, and if the concern persists, follow internal protocols for reporting discrepancies that may affect patient care. Option D. Immediately disregard the audit findings, assuming the original report was accurate, and proceed with the patient's prescribed management plan. The correct answer is C. Consult with a senior optician or optometrist within the practice to review the audit findings and histological documentation, and if the concern persists, follow internal protocols for reporting discrepancies that may affect patient care. Explanation: this scenario presents a professional challenge because it requires balancing the immediate need to address a potential patient safety issue with the established protocols for reporting and investigation. The optician is faced with a discrepancy between their understanding of ocular histology and the findings presented, which could have implications for patient care if not handled correctly. Careful judgment is required to ensure that patient welfare is prioritized while adhering to professional standards and regulatory guidelines. The correct approach involves a systematic and documented process of investigation and consultation. This begins with a thorough review of the patient's records and the specific audit findings. The optician should then consult with a qualified supervisor or a more experienced colleague to discuss the discrepancy and seek their expertise. If after consultation, the concern persists and suggests a potential deviation from standard practice or a misinterpretation of histological data relevant to patient care, the next step is to follow the established internal reporting procedures. This ensures that the issue is formally documented and investigated by the appropriate parties within the practice or institution, aligning with the principles of patient safety and professional accountability mandated by regulatory bodies overseeing opticianry practice in the U.S. An incorrect approach would be to dismiss the audit findings without further investigation, assuming the initial interpretation of the histological data is correct. This fails to acknowledge the potential for error or oversight and neglects the professional responsibility to ensure the accuracy of patient care decisions, potentially violating patient safety regulations. Another incorrect approach is to immediately escalate the concern to external regulatory bodies without first attempting to resolve it through internal channels and consultation. This bypasses established internal review processes, which are designed to efficiently address issues and may be perceived as unprofessional or premature. Finally, attempting to directly correct the histological interpretation or patient management plan without proper consultation or authorization, based solely on personal interpretation, risks introducing further errors and violates the hierarchical and collaborative nature of professional practice, potentially contravening guidelines on scope of practice and professional conduct. Professionals should approach such situations by first gathering all relevant information, then seeking expert consultation to clarify any ambiguities. If a genuine concern regarding patient safety or professional standards remains, the established internal reporting and escalation procedures should be followed diligently. This structured approach ensures that issues are addressed systematically, ethically, and in compliance with all applicable regulations.